Hello, everyone. My name is Jeff Dreher, and I'm presenting a new health promotion initiative which targets the improvement of the community's overall health, and in doing so, assures our hospital is fulfilling its responsibilities to our surrounding community. Here we have an overview in the United States, where 1 in 3 deaths each year are from heart disease, stroke, and other cardiovascular diseases. Nearly 31 million Americans smoke. 74% of adults are overweight or diagnosed as obesity, and 96 million adults are pre-diabetic. In Arkansas, I have the leading causes of death, number one being heart disease, followed by cancer, chronic lower respiratory disease, some of you may know this as COPD, accidental fatality, as well as stroke. Heart disease and stroke, knowing your risks. Cardiovascular disease risks include high blood pressure, high cholesterol, diabetes, obesity, and smoking. Stroke risk factors include high blood pressure, high cholesterol, diabetes, obesity, and previously being diagnosed as a stroke. Stroke awareness would be our new health promotion initiative. And in doing so, we're going to define what is a stroke. We want the population to understand that there are two types of stroke, whether it be a blocked artery or a ruptured artery. We would like to create awareness on what to do if we believe we're having a stroke, who we should call, how we should react. We also will be doing awareness on how to prevent from having a stroke. And for those who are unfortunate enough to have had a stroke, life after a stroke, creating awareness and promotional incentives for those who have already had a stroke. Stroke prevention. The American Stroke Association has some wonderful prevention materials which we would be able to give to our community. All right. This would include secondary stroke prevention checklists for our healthcare professionals. We need to make sure internally that our healthcare professionals understand what to do when we're dealing with those who have either had or believe they are having a stroke. Life is Great. This is an interactive video for children, reaching the target audience, teaching them on what to expect as far as heart health and brain health. All right, two things also piggyback off that would be a prevention quiz as well as a word search or word finder for kids. For adults, we do Strokes Can Happen to Any Age. This is a PDF that educates on what and why strokes typically happen, as well as stroke prevention brochure. And then also understanding the difference between a heat stroke and a regular ischemic stroke. Community outreaches should include stroke awareness and prevention events for both our schools, sporting events, and places of employment. We want to target as many people as possible with our outreach. We can do displaying announcements at various events, newsletters, webinars, websites, commercials, announcements and promotional notices throughout the community, hosting or attending local gatherings, social media advertisement, and so on and so on. So why stroke? Population health, 1 in 3 causes of death in the United States. Number 5 leading cause in Arkansas, and the risk factors associated with stroke mask and mirror many other risk factors of other heart diseases. Service provided, preventative testing and awareness, telemedicine to prevent ED and hospital excessive use, and then also post-rehab and behavioral health to help cope with the lasting effects of having a stroke and returning to the optimal level of health and well-being. And service supported, will be pre-admission testing and outpatient testing volume will increase with screenings, inpatient service lines expansion to support the community around us, and then acute rehab qualifiers. Every stroke patient is a qualifier for rehab set by the standards of Medicare, and in doing so, returns that we assure our Medicare qualifier numbers are met for every year. Thank you for your time.